All right, 6:24 now on your Thursday morning, and although we just wrapped up National Stroke Awareness Month, its prevalence just doesn't go away. The CDC reports nearly 800,000 have a stroke in the United States each year.
That's right, and Dr. Deepak Nair, a neurologist with OSF Healthcare's Illinois Neurological Institute, joins us live this morning to tell us what to look out for. Good morning. Thank you so much for joining us.
Thank you for having me.
All right, so can you tell us a little bit about what a stroke is? Break it down. How does it happen?
Stroke is a catch-all term. It refers to the clinical signs and symptoms that we see when there's been some sort of disruption of blood flow affecting either the brain, the retina of the eye, or the spinal cord. So most of the time, about 85% of the time, that's because something has blocked the flow of blood. So that could be a blood clot or plaque buildup inside the artery, clots that travel from somewhere else in the body. But about 15% of the time, it's because there's been bleeding into some part of the brain.
Oh. Wow. Okay, so obviously scary to go through. I know we talk about, fast. Is that the sign? Go through
That's right.
what that is and how we should respond when we see the symptoms of fast.
Absolutely. So FAST is an acronym that we use to kind of teach about the most common and serious symptoms of stroke. So it stands for facial weakness, usually on one side only, arm weakness, again, typically on one side of the body or the other, speech disturbance, right? So somebody not able to get the right words out, or their speech sounds completely garbled. And then T stands for time. As we say in the industry, time is brain. And that's been morphed over the years because of our better understanding of stroke. So the current acronym we use, I think you're displaying this, is BFAST, which adds in B for balance disorders and I for eye movement problems.
Are there any treatments going on that can help those who have struggled from a stroke or make the recovery better?
Certainly. So that time is brain refers to we have some opportunity to intervene early on in a stroke to minimize the damage being done. And there's sort of two main categories of treatment. So I'm a medical doctor, and on my end of the fence, we deal with giving quick clot buster drugs to try and break up blood clots and restore blood flow to the brain. Then I have colleagues who also put catheter devices through the arteries into the brain and actually physically remove clots and plaques. So those are sort of the two things that we were able to do early on, but those have to be done earlier to minimize the damage.
Right.
So how do I prevent it's just scary all around because it can be life-changing after.
Absolutely.
How can we kind of prevent, what proactive steps can I take to not get to that point?
Yeah. So I often tell my students who are typically fairly young, I always joke that the best time to start preventing your stroke is when you're in your 20s, and the next best time is right now. So we think that based on the risk factor profiles, about 80 to 85% of all strokes are preventable, and we focus on the main risk factors for vascular disease, things like blood pressure, smoking, diabetes, high cholesterol, some heart-related conditions. And so, getting all of your regular medical cares when appropriate, if you already have some of those risk factors, really focusing on managing those as best as possible.
So I know a lot of people who may live alone or don't live with somebody who's as educated as BFAST would be. We always like to go to WebMD, right? Google our symptoms, see what it comes up with.
Which isn't always the best.
Exactly, exactly. Just makes everything go right downhill. But what are some of the things that we can do ourselves if we're living alone to recognize that we may be going through a stroke?
So again, being aware of those symptoms, it's tricky sometimes because stroke patients don't always know that they're having these problems.
Right.
The brain is really good at sort of masking our own problems, and there's certain situations where you may be completely unaware that you're having those deficits. However, if you're noticing trouble with movement of one side of the body, sensation on one side of the body, speech problems, and especially if it comes on suddenly like that, that's always worth some attention.
All right, for sure. And of course, you can find out all this information on our website, ciproud.com. Thank you so much for sharing all the ins and outs of stroke, just so we can understand a little bit better and hopefully help others out as well.
Thank you.
Thank you.